Welcome back, everyone. And now we have a panel discussion. You have already met all of our speakers, and I am very happy to moderate this session. And we're going to start maybe after Jason's last lecture, when we were talking about the tools that are available for clinicians. Maybe this is a good opportunity to talk about one of the other resources that Purina Institute has provided and has now been launched in Latin America, which is the Clinical Nutrition Handbook. Would you be able to talk about that tool and how it helps clinicians?
Yes. Am I on? Yeah, okay. So yes, the Clinical Nutrition Handbook was launched initially in 2023. Many of you that are live here with us should have received it. It is a phenomenal book. It's written by over 40 key opinion leaders, including the folks up here in their areas of expertise. But it is meant to be informative on how to integrate nutrition into those health conditions, whether they be gastroenterology, dermatology, urology, and so forth, and ease those conversations. It gives a background on what the condition is and then how nutrition is integrated. And again, I'll just put myself out there as a veterinary nutritionist. Please have the conversation every time, and you'll find every topic in that book. Nutrition belongs in all appointments. That was the start. That book, Dr. Sheinberg, was the start of Purina Institute creating another book, actually. So we have the Clinical Nutrition Handbook that our folks here have all received. Thank you. And what we're doing in August of this year, so just next month, at the end of next month, we will be launching at Purina Institute the Well Pet Handbook, which one would argue is actually more important in a way, than the Clinical Nutrition Handbook. Because again, as I mentioned during my presentation, if there's 10% of cats and dogs that have conditions, there's 90% of dogs that can be really optimally fed through wellness food. So please be on the lookout for that. We'll actually have a launch event on August 28th in St. Louis, and I'll be moderating that session and have some fine folks with me. So I would also like to take this opportunity to toss this question over to Dr. Lappin. I believe you were part of that original session when we launched the Clinical Nutrition Handbook, and I ask you if you have any words to say about that.
Yes, it's really great to have that access again. I'm an academic veterinarian that I also teach the community practice, so the primary care people. I'm the senior advisor to that group, and then internal medicine is my day job. But I wanted to let you know that CSU has decided to have that be part of our core materials for our veterinary students. We have a first-year student nutrition course that goes a whole semester, and so that is now part of their curriculum. And I know my residents in internal medicine, they use it quite frequently. And I'm going to admit right now that just last week, I read Dr. Quimby's part because she's a kidney goddess.
So we could take an opportunity having the authors of this book here, and maybe the rest of the authors would like to say something about their chapter, how it helps clinicians approach those diseases. Dr. Quimby.
Yes, it was about kidney disease, for sure.
We noticed that.
Yeah. So if I had to highlight some of the main points, I think, for nutrition in chronic kidney disease cats, I would definitively talk about the importance of caloric intake. For me, and actually having studied abnormalities of appetite, the appetite dysregulation that happens with chronic kidney disease, that's we touched on that here somewhat, but didn't really get a chance to delve into it. And many of you have come up to me during the break to ask questions about how to medically manage those cats when they're struggling with their appetite. That concept of taking a good dietary history and understanding how much is that cat actually eating, because very frequently it is not eating enough, and then realizing that we have to improve their caloric intake is a huge part of what we do. And then for each patient, we are going to make an individualized nutritional recommendation for them to assure that, you know, this cat might need this level of potassium or phosphorus or protein, whatever it is for that individual patient. So for me, it's a very individualized approach, and we are not going to have success for these patients if we're not getting them to eat. And that's why we've spent so much time studying appetite dysregulation and appetite stimulants to try to ensure nutritional success in those patients. So that's the highlights for me in terms of then you're launching into your dietary strategy, but you must have that information first.
I believe my chapter was primarily focused on urolithiasis. So we did talk about it was primarily dogs, but we did a study, and it was with Purina, and we were looking at dissolution diet for struvite again, but this time in dogs. And I'm sure you know, too, pathophysiology from dogs and cats on their struvite formation is different. Most dogs with struvite stones form due to infections, primarily urease-producing bacterial infections, albeit we are doing a little more work on other mechanisms for ammonia production and the urinary microbiome and how that could relate to struvite. So that's some of our ongoing research that stemmed from this. And the key point for us, too, which it goes back to, is there nutritional management for that? And can we dissolve these stones in lieu of going to surgery and doing either cystotomies, or we have many different minimally invasive procedures like laser-lithotripsy to remove the stones. And we were able to show, at least in our small data set, that we could successfully dissolve and alleviate clinical signs in at least 50% of the cases. And some people might say, oh, just half? But I thought, that's half. I saved half my dogs from needing to have a surgery or needing to spend several more $1,000s on lithotripsy. And most importantly, and I think our goals are similar as veterinarians, how does my patient feel? Is it comfortable while I'm trying to dissolve the stones? I put it on the proper antimicrobial. Signs go away very quickly, even if they don't fully dissolve or they take a long time to do so. And if the signs don't resolve quickly and you can't control them with analgesia, then certainly we took those to surgery right away, because the patient welfare is really what's at all, I think, our core philosophy in how we practice vet med. And there was some other, I believe, concepts in similar to some studies we did with urate too, but I'll let you read that.
Thank you, that's wonderful. Jason.
Yes, Galia, thank you. I just wanted to follow that up and just see, you know, as we're talking with these wonderful experts here, and they're discussing their chapters and how nutrition is integrated into each of these disciplines of veterinary medicine. I did want to take the moment to also just reinforce that the use of this book can be done by anyone within the veterinary hospital. The book is meant for the veterinary health professionals, whether that be veterinary technicians, nurses, anybody that's on staff at a hospital. So please consider, if you don't have a QR code available to you, I know, again, live, the folks here have received this book, but for those folks that are virtual, please consider visiting purinainstitute.com, registering, and you can download a free ebook in that sense. So looking forward to seeing how, again, as the veterinary landscape changes, how nutrition and how this book can help to influence optimal health in pets. Thank you,
Wonderful,
Galia.
thank you. So we want to remind the audience here to ask questions. So you are invited to raise your hand and ask the panel any question that you might have had and not the opportunity to do so before. So we have some prepared questions from the previous days. So I will start with some of those. So we have a question here. They're open, they're not specifically for any of the speakers, so you're all invited to answer. So we have a question here that says, what strategies do you recommend for introducing renal diets to chronic kidney disease cats with or without GI disease? So, again.
Yes, that's an excellent question, and it relates very much to what we just previously mentioned about wanting to optimize nutrition and wanting to optimize caloric intake. The very first thing that I would say about that is that you need to first identify what is making that cat feel ill, and also identify that there is an appetite problem and address that first before trying to get long-term compliance with that diet. So if the cat is anemic or dehydrated or has low potassium, those things make that cat feel terrible, and it's important to fix those first. And then also address appetite medically is what we very commonly do, and then we launch into our plan to get that cat onto the renal therapeutic diet that we would like them to be on long term. You're not really going to get anywhere, especially if they're currently feeling nauseous, with trying to transition them onto a diet at that moment. So it's a long-term goal for me. I fix as many things as I can. And then as we're offering it to them, again, we very commonly say, here are multiple, wet and dry choices for the diet. Which will your cat like the best? And try to let that cat choose what is going to be the thing that they like best. Also, normalizing the rotation of foods. It's very unlikely the cat is going to eat one single diet long term. They have this habit of wanting variety and the novelty that we spoke about. So offering those things in rotation, expecting that there will be a rotation, and normalizing that for the caregiver, I think will give you better success in that long-term goal. The transitions can be very long, and there's many ways to offer those foods as we transition, but my biggest take-home message is try to make that cat feel better before you even engage in that, instituting that long-term dietary strategy.
I was just going to say, I don't know if we, it sounds like we're on the same page too with regards to, I always just remember the wonderful Dr. Sherry Ross. And, Sherry loved her cats and did many, was a great advocate for feline medicine too. And she always emphasized to never feed the desired food while that cat is in the hospital. Take the time, like you just said, send it home with them, try the different varieties. And in those short few days, hopefully it's not too long, they're in the hospital, they're going to be okay, and hopefully you can get them home and transition them in a more tailored manner. Yep.
Yeah, and to build on everything that Dr. Quimby and Dr. Westropp said, it's recognizing that feeding is important, and there's going to be periods when there's nausea or gastrointestinal malaise. So what you're wanting to do then is maybe having diets that you're going to consider as scapegoating. You're going to be, this is the diet that they're going to get sick on, but it's not the one that you want to maintain them on. So it's okay that you're going to transfer an aversion on that diet. You're moving on to something different. If you remember everything from my talk yesterday, different flavors can help in terms of rotating through. The other thing too that Dr. Quimby mentioned, which I think is really important, is this appetite dysregulation. It also changes their feeding behavior. So you're going to have to expect for your clients to understand that their normal feeding behavior may change, and they may actually require multiple small meals for wet and dry food, and it's just going to require a little bit more patience and a little bit more encouragement in terms of positive expectations around the feeding occasion.
Wonderful. And this leads us to another question. I think it's more open to all the panel because I think there's different expertise and different takes on how you would approach this. Can you provide guidance on how you go about communicating with owners and caregivers to make sure that they are kept on board during the process of transitioning and finding the right diet for your feline patient, depending on the therapeutic approach? So,
I think that's an excellent question. I've come across that question before. And I'd say it kind of goes hand in hand with what was just asked. And I agree wholeheartedly with what Dr. Quimby and Dr. Lyn here had mentioned. I do expect, I am one of those nutritionists in a clinical setting that I will actually sacrifice a food first and not expect them to be eating the food on maintenance, whether that be kidney disease, urinary, gastrointestinal, and so forth. I'm more interested in feeding the patient. I'm not necessarily interested in feeding an organ. So we need to get them we need to get them stabilized, we need to get them maintained, and then we can then perform a transition. I do up front discuss with owners and communicate with them that this food that we're sending them home with may not be the final food that the cat is going to be maintained on. So in that sense, I will send them home with a variety of options to try one at a time, not all together. I'm not one of those that believes in the smorgasbord, because foods have aromas that could mix and create different through the olfaction system and alter taste. That said, I would toss this question over to Dr. Sandra Lyn here and ask her expertise with the smorgasbord and what your thoughts are on that.
Well, I wasn't going to think about it from a smorgasbord perspective. I was actually thinking of Dr. Sheinberg's question in a more general manner. So I'm going to go away from what Jason was suggesting and think about something I actually learned from my sister. And it's just when you think about your giving advice or recommendations to your patient for your clients, the question is always ask them to reflect back what they heard. Because a lot of times they're stressed. They're very concerned about their pet's well-being, and they're hearing things, and you might think they understood exactly what you said, and if you have them reflect back to you what they just heard, you might be shocked to realize that you were not at all in the same conversation. So that's really critical, is to do that. And the other thing too is help them understand the why and what's really important, and then have that discussion, because maybe they're able to come with a solution that will work for them with their lifestyle, their current home environment, rather than trying to force fit a specific solution. But I think really having that conversation and talking it out, and it may, in the end, actually be beneficial for you, because you have new tools in your toolbox for how you can deal with future clients and their cats.
Yeah, I agree with all those comments so far. I think a couple of things, though, that we all recognize is there are 13 or 14 things that we could manipulate to try to keep a cat with chronic kidney disease moving forward in a positive way. But diet is probably one of the most important ones. And so I wanted to make sure that Dr. Quimby and I still agree on this from when we were together at Colorado State, that it's still better to eat than to not eat. And many of our new grads, they're so into, we have these kidney diets, that they force them too soon, as we've already established. But it would be better to be on a diet they'll eat than to eat your own body by starving and becoming even more sarcopenic. And so I think it's starting simple with them, because it's frightening. They're grieving because this is probably ultimately a life-ending disease, hopefully a long time. We're so successful these days. But they're already stressed out, right? And if we start talking about the 13 different things we might manipulate on the first discharge instruction, which is what happens with a lot of the young doctors at a major university hospital, is we're so into the science, right? And so trying to keep it simple up front, knowing and making it very clear that we're going to be manipulating this animal's diet, plus or minus supplements, to achieve some of the other goals that we might not be able to achieve with a one diet alone. Obviously, my brain goes to the constipation and the diarrhea part, which I think was part of the first question, is if they need a kidney diet, but they also have diarrhea, which isn't the usual, it's usually constipation, but then you could deal with that with other supplement pathways. And so it really is about manipulating different diets and supplements over time, as we've all stated.
Yep, and sorry, one more thing, that the very concrete take-home piece that I would give you is that we must count calories, and the caregiver must count calories. And we always think about counting calories for weight loss. It is just as important, if not more so, to count calories to gain weight and to not lose weight unintentionally. So first of all, we write everything down because of what Dr. Lappin just mentioned. And it's very common for us to evaluate the nutrition of a cat and discover that the caregiver perceives the cat is eating enough. And sometimes they're literally unintentionally starving the cat because they think that 2 little cans is enough. And it's not. So when we say this is only this many calories, we calculate exactly how many calories we want that cat to eat per day. And we write all of those things down and we say, this is how much this quarter cup of a dry food is. This is how much this can of cat food is. Your cat has to eat these many things a day in order to make that caloric goal. And that is something the caregiver can be involved in and be aware of. Some people will not do that. Sometimes I get little graphs, Excel spreadsheets of what cats are eating on a daily basis. Owners, they really get into it and they come in with their graphing it over time and telling me, I had one caregiver say, there's been a statistically significant increase in caloric intake since I started my cat on the appetite stimulant. And I went, can I use this graph in my lecture, please? So we give them concrete information so that they have a guide of what to do. And in the US at least, all the kcals per cup and per can, they're on the bag. And we also give them a diet list that says, this is how many kcals this can is, and this is how many kcals these kibbles are. You have to come up with whatever your cat eats that day, and it will be multiple diets likely, but this is the number you have to get to. We have to get to 200 kcals in this day, and if we're not doing that, then you will be losing weight. And that's where we're going to use our appetite stimulants, et cetera, to support that appetite, or do they actually even need a feeding tube? So it gives them a very concrete bar to be able to assess on a daily basis how that cat is doing. And every single patient we see, they get that in their discharge instructions. This is how many calories we want you to eat, and this is what we can do about it.
That is fabulous. Go ahead.
Oh, I just had another question for Dr. Quimby along those same lines. Is some of our pet parents won't count the calories. Yeah. We teach them how and all of that, and they just don't do it. So I was just curious about, as a surrogate, if they had the same scale that they used weekly and recorded weight. Yep. Could that be a surrogate to counting calories for the less intense client?
Yeah. So in addition to it, and there are many people who are not on board with that, but it's more about giving them a realistic benchmark. So if they know now that 2 cans per day is not enough and they need that little extra handful of kibble, that at least they have a concrete measurement if they don't want to keep track. And then yes, we absolutely recommend that they weigh the cats at home. That's where the litter box monitors for us can be very helpful. Or we have them purchase a baby scale from Amazon, and they will weigh that cat weekly, and they'll let us know, if we start having a problem with weight loss. Yeah.
Excellent. Jason has a comment.
Excuse me, Sandra. I just wanted to follow that up with, so in addition, as we look at that question and just, mention, we have this owner that we're speaking to, we're communicating with, reinforcing potentially that sacrificial food, as I had mentioned and others had mentioned initially, then going home, having them understand the importance of the calories, how to weigh at home, keeping track of, the calories, and then the transition doesn't necessarily need to take place overnight or a week, as long as some cats are going to take longer than others to transition as well. So to be patient, to try different foods, to connect with the veterinary team in terms of if they do need an appetite stimulant as well. But also, at the same time, I would say that this is something that if you have the ability to do in hospital, I would encourage the veterinary staff to reach out proactively to that owner and see how the transition is going, keeping track of that, because that can also, we could be a little bit more proactive about that.
And I want to add something here, and it's not that I want to pull away from chronic kidney disease, but from the dermatology standpoint, and for the clinicians here who do a more wide variety of medicine, I think that owner communication, and we've discussed this during our time here, is so critical. And I found that the way that I approach my clients today has become much more flexible. So I want to do a therapeutic diet, let's say, for example, a hydrolyzed diet, or I want my patient to lose weight, because we do address weight, because now we know it's so important in terms of the lifespan of the patient. But I think that going back and remembering that the way we communicate with clients and having flexibility for them to adapt to a diet, to adapt to a change, and more importantly, not feel forced to do something. And I think that a lot of young clinicians tend to, as you mentioned, just say, we need to get this diet in. But if we force clients to do something they're not open to, we're not going to achieve that. So I think that the owner communication and the approach to the client is so important. And Jodi and I were discussing this last night, and I would love for you to add something to that, because I find that I will have success or failure depending on how I approach the client. And also, before I finish, I also like to provide them with handouts or links for them to either watch videos or learn additional information about my diet recommendation and the reasons that I'm trying to provide that change.
I think that's outstanding, and it's just so important to empower your clients. These caregivers, these owners, they're very worried, they're very upset about their pets, and I think the most frustrating cases I see are usually cats with FIC, because by the time I see them as at least a tertiary care facility, they've seen 4 or 5 other veterinarians, and they obviously at that point, they didn't have enough grasp on what caused the disease. Even though we don't know, you can explain, at least in lay people's terms, what science is saying and how they can better grasp then on how we increase those palliating factors to manage it. And it all comes down to communication. So I will initially evaluate the cat and make sure it has FIC, no other organic cause for the signs. I have, after that, had appointments with the clients not bringing the cat. Because I need to get them online with me. I need to make sure they have all the resources they need and what kind of questions they had. And I don't need to stress that cat out again by bringing it back to the clinic, but you need to charge for your time, right? That's part of your day. And then, I mean, I was always taught, and this isn't, my exact recheck schedule, but there's a 3-day, 3-week, 3-month. Right? I call them someone in the clinic, call, email in 3 days. How are the changes that we decided upon together, whatever therapeutic plan we decided together, how is that going? And the reason I think that's important, obviously you can adjust it, right? But if they're doing well, it provides you the opportunity to give them a bunch of positive feedback and reinforcement to keep up the good work. And then again, 3 weeks and 3 months, and they're cats, just like us, you need to adjust things over time. And even if things aren't going well with the patient, I find that at least keep things going well with the caregiver, and that allows them to progress in the right direction.
If the owner feels they're not doing well, sometimes they won't come back. They will be afraid to talk to the clinician because they're afraid they might get scolded for not doing it well. So even if we're not obtaining our goals, again, let's say a hydrolyzed diet, which can be very challenging, we need to let them know that there are other options and that we can do something else for their cats, and we don't have to stick to a specific path. So I think that's very, very important. I don't know if any of you have something to add to this.
Yep, I would say that just talking about the concept of caregiver burden is very central to this as well, because we want to have those conversations, but everyone has different background. Everyone has different burdens that they're bringing to the table. And the biggest thing that you can do for that client is to ask them about their situation and what might be barriers to care for them. If we don't ask those questions, we won't understand why they might not be able to be compliant. And there's, especially with kidney disease, but for many other diseases, in cats, it's been well studied that there is caregiver burden associated with chronic disease, giving the medications, the appointments, the finances, the social burden, their worry and their anxiety about that beloved pet. So having a good conversation with them to ask the why behind what their thought process is and where they're at and what they can and cannot do, those are very valuable conversations in order to better make an individualized plan with that caregiver and this particular feline patient to be able to have the best outcome. It's going to be that, you could call that spectrum of care, you could call it what you will, but getting behind what they're bringing to the situation and understanding what might limit them is very powerful. And try to palliate that caregiver burden as much as possible by better understanding where they're coming from.
Great. So we'll take another question from the previous discussions, and I believe this one is for you. What nutritional characteristics or differential additive management do the therapeutic diets for the urinary tract have?
That's a broad question. It depends on what urinary disease you might be treating. And I might pitch this over to Dr. Gagné, our board of nutritionists, because I feel like dietary questions, I have an expert here. But looking at it as an internist, if we're looking at dietary management again for FIC, remember that we don't have, in most of these clinical studies, in the affected patient long-term with most diets, because they're really hard studies to do because the disease often waxes and wanes, and it's highly variable in its presentation. If I think I mentioned yesterday, if I consider dietary therapy for, the non-obstructed FIC cat, I think there's some justification, if you will, for perhaps the anti-stress components to the diets. Looking at dietary management of stone disease, it obviously depends on what urolith is present, what age the cat is, that's going to depend, and what comorbidities are present. And I think I'm going to let Dr. Gagné take the actual components of the diets, because I know that this is more going to be the actual magnesium, calcium, protein, pH, et cetera, that is up your alley.
Yeah, thank you, Dr. Westropp. I appreciate that. Yeah. So I'd have to agree with you that, it really depends what urinary condition we're talking about. And then even within there, what is the stone, for example? So regarding stones, I think we tend to think mostly about struvites and calcium oxalates. I think, those being the two most prevalent. However, the levers to pull, or what to consider in a nutritional formulation, is a little bit different with each one of those. With any stone, though, moisture remains the number one consideration. So this is typically, legacy, why we tend to promote more of the wet food for those cats. And that goes to a communication issue as well with the owner of what does your cat typically eat. And then if you do have the ability to transition them from a dry to a wet, if that's even possible. I've transitioned cats over time, and my longest one, probably it took me 6 months to transition a cat to a wet diet from a dry. So, don't be surprised in that regard if you do attempt to go that way. And again, I will stress, what I was saying earlier about being more proactive about a staff reaching out to owners. And I like Dr. Westropp's 333 protocol in that sense. But getting back to the question of what levers to pull, if I was to work on creating a urinary diet, I would consider getting having the correct ingredients that do not, or that are not rich in oxalates, for example, that do not promote an alkaline urine, and that I could toggle to be between a certain pH range that inhibits the formation of struvites, but at the same time doesn't get so acidic that may encourage calcium oxalate formation either. Again, please consider moisture as the number one in that regard. When we're talking about FIC, that's a little bit more vague, and I think there's a bit more research to be done in that regard. And from a Purina standpoint, I'll again thank Dr. Westropp for that partnership that we formed with her lab there. But I think there's a bit more to be done. There's been several papers on FIC over the years. Some dietary studies, but as we critique them, just like any study, you can see some study design flaws in them as well.
Yeah, I mean, the studies that are published, again, I always commend the authors who do these. Those are such hard studies to do, and we've even discussed trying to do FIC studies, but the one that I have ongoing right now, it is a short-term one looking at biomarkers, because we know as things go after that, there's so much fluctuation, there's changes in households, it's a hard thing to monitor, and we don't know too, especially, hopefully I demonstrated yesterday, the need for placebos, because there is so much caregiver by proxy placebo in some of these treatments for FIC. Fortunately, I'm grateful for it, the impact of environmental modifications and our interaction with the cat. So I think diet, certainly in humans, and it can in cats, it probably plays a role. The studies are difficult to do in these circumstances.
And to that point, I think the veterinary landscape is really evolving in that sense since, let's say, some of the studies in the 80s and 90s. That occurred, and I'm grateful for that. Some of the memo, protocols are, I think, extremely important to consider. Especially when we talk about FIC. So yes, maybe diet can play a role, but that is truly a multimodal therapy that needs to be considered. We ask the question: the environment? How much of a role does the environment play with the development of FIC? I think a tremendous amount. I think we would all agree with that. So how do we go about looking at that environment, mitigating those causes, utilizing memo? But in terms of stress alone, I think that's we've really advanced in that regard, and we have a lot more work to do.
And as a final question, and this is an open question for all the panel, can you speak to the role of nutrition in the human-animal bond? And from your clinical perspective, we have about a minute and a half left.
I'll take a more psychological perspective. Food for a lot of people, it's a way to communicate love. We see now a lot of explosion in terms of what is defined as pet food. And a lot of that is coming from, my pet is now seen as a family member. And a lot of times when you ask in surveys, pet owners are coming back and they're saying that sometimes they love their pets more than another family member. And so as a result, you're seeing that food has a lot of emotional components to it. And I think we really need to understand that piece, because it's going to affect compliance with all of our experts here, what they're asking their clients to do for their patients. It's going to make it really, really hard for compliance if we aren't considering that in terms of the bond. But also, you heard from Jason this morning about the lifelong study that we did with dogs. It's also giving, I think sometimes when we're talking to pet owners, we have to give them choices. So really putting it in lay terms, do you want to have your pet live longer and healthier? Or do you want to have the immediate joy of feeding them now, where you're giving them a lot of calories? Have them articulate it for themselves, and then they're making that choice. So then once they make that choice, now you can get on board with them in terms of how you go forward and plan your treatment plan for either a well pet or moving forward with nutritional therapies.
Thank you so much. And I want to thank our panel for their very thoughtful answers and their time. Thank our panel, and we're done with this session.